So I'm delighted to have been appointed as the interim chair of the Gibraltar Health Authority. I believe that's a great honour and a great privilege. It's a non-executive role, which means that my job is to make sure that the governance is in place to provide the oversight of the executive team that's being led by the new Director General, Professor Patrick Gagan.
Professor Cumming, can you tell me when will things start to get up and running?
So we started now. I'm having regular meetings with the Director General and others. The next key milestone is to have the appointment of the other non-executive director members of the board, but we're currently planning to have our first full board meeting towards the end of March to really go live from the 1st of April as we enter the new financial year.
We've heard about the Reset Restart plan, but the GHA has come under some harsh criticism of late. So can you tell us, what are your main challenges going forward?
So I think there are a number of challenges facing every healthcare system around the world as we try and recover from what has been a really damaging 2 years in terms of the COVID pandemic. So we've seen waiting lists lengthen, we've seen people not access routine healthcare because of concerns on one hand, on the other hand because services are so busy. But I think for me, the key challenge in Gibraltar is to make sure that we get the right care delivered by the right person in the right place at the right time, and that we focus on the quality of care that's being delivered. And one of the messages that I'm hearing loud and clear from the population of Gibraltar is with regard to access. People don't want to wait for GP appointments. They do want people to answer the phone. We need to make sure that the right people are accessing ambulances, the right people are accessing pharmacies, the right people are accessing A&E, and the right people are accessing primary care in terms of their conditions. So I think for me, that's a significant piece of work we need to take forward.
And will you be changing the way in which you manage complaints from the public as well?
So we need to be responsive to every complaint that we receive from the public. We need to make sure that complaints are properly investigated. What I want to do as chairman of the GHA is to be out and about, talking to groups, talking to societies, talking to stakeholders, partners, and obviously talking to government about the sort of services that we're providing. But we also need to make sure that any immediate concerns or complaints from patients are being addressed by Patrick Gagan and his team of executives in the hospital and the other services that the GHA provides.
And how will you manage areas of public interest and accountability of those running the GHA? As I said earlier, there has been some harsh criticism of the GHA, so how will you manage those situations?
The board of the GHA is accountable to the Ministry of Health and through the Ministry of Health to the government. So the government will hold me to account for the work of the board, and in turn, I will hold the executive to account along with my fellow non-executive directors for ensuring that the highest quality of care possible is delivered to the population of Gibraltar.
How would you say the GHA compares with the NHS? The NHS is obviously a far bigger organisation, but how would you say it compares?
So I think that's actually a very difficult question to answer because the NHS always relies on what we call mutual aid. So if a hospital is busy, if an ambulance service is busy, if a GP practice is busy, then there's always another one round the corner. That isn't the case in Gibraltar. So Gibraltar has to be able to cope with anything and everything. You have to be prepared to deal with a major incident, but you also have to provide responsive and timely care to mental health or primary care or other people who are in need of our services. In terms of funding, the GHA is funded per capita at a slightly higher level than the National Health Service, so the resource should be there. But equally, in some cases, things simply cost more in Gibraltar than they do in the UK. But from my perspective, the fundamental building blocks are there to have an excellent public healthcare system in Gibraltar. And by focusing on a few of the key challenges, I would expect to see improvements in that healthcare system over the next 12 months.
And will the 7-point plan take us, in your opinion, to where the GHA needs to be?
Yeah, so the 7-point plan, which was, I think, a very brave move by the government to separate the Gibraltar Health Authority from politics, to actually turn it into a proper freestanding authority, allows us to focus very specifically on the governance, the management of services, on the strategic direction of the health authority. As I've already mentioned, it allows the board to hold the executive to account for delivery, And above everything, we can then be held to account as the GHA by our colleagues in government for spending the public pound, because we need to spend every public pound in the most appropriate way we can, particularly and especially when money is so tight as it is at the moment.
Will you be based in Gibraltar? How often will you be here?
So I've spent a reasonable amount of time in Gibraltar over the last 12 months, particularly in my work with the vaccination programme, but also some other aspects of the healthcare system that I've been asked to advise on. What we've agreed indicatively, but this isn't firm, I can flex this as necessary, is that I will be in Gibraltar for approximately a third of my time.
And one more question, if I may, about the Pfizer vaccines. These have been supplied to us freely from the UK up until now, but we understand that they're no longer guaranteed. Could you just give us a brief overview of how the situation currently stands?
So the UK government have given a continued commitment to supply all the overseas territories with the vaccine that people need. There is a logistics point that's relevant, though, that as we end up with smaller and smaller people needing vaccinating, the Pfizer vaccine is only available in quite large pack sizes, and these pack sizes can't be split. So what we won't be able to do is to send a large pack of vaccine from the UK to Gibraltar, because we will end up throwing a huge amount of it away. So what's being worked on at the moment is looking at ways in which either smaller pack sizes of Pfizer could be provided, or alternatively one of the other vaccines that is available in much smaller dose sizes. So for example, the AstraZeneca vaccine is available in packs of 80 doses. Whereas with the Pfizer vaccine, there's well over 1,000 doses in a pack. So it may be that there is a switch to a different vaccine, but there is no intention that I'm aware of the UK government ceasing a supply of vaccine. It's just it will become more complex once we get past the expiry date of the current batch.